Okay. Do you know who we're interviewing, by the way?
No idea.
No idea. Okay, so we are having on Layne Martin. He is a sleep specialist, and I am very excited about this episode because I don't know if you feel the same way, but sleep is a very hot topic, like all over. It's kind of taboo because there's all these people claiming to be experts when they're not. And so, they warn us when you're a student, it's not our territory, but then sometimes it is our territory. And obviously, it can be lucrative and it's interesting. It can make a big difference. So it's kind of like this weird space that everyone is curious about, but also kind of scared of. And he has an interesting story because he started as a dentist and then he went back to orthodontics residency. He said when I talked to him the first time, just to have the credibility for what he's doing, he felt like he needed to have, I understand the bones and the everything going on in the face and the airway, and that's what like orthodontists do. So he felt like that's why he did it. So like he doesn't practice orthodontics at all.
I mean, it does feel like a lot of healthcare is moving directionally into a more holistic kind of environment, with diet, nutrition, sleep, where the individual can control more of it than the, medical treatment or dental treatment that you get externally.
Totally. And I think
That'll
what's
be
cool
interesting.
about sleep is that like every single person can relate to wanting to sleep better. Like who doesn't?
Right.
And the more you know about all these different topics, even if you have no intention of actually treating people for sleep, it's kind of like the jaw episode, the jaw pain guy. Like, I don't plan on treating anyone for jaw pain, but if my patient experiences it, I want to know how to guide them, you know, when to freak out, when not to freak out. And so I just think it's important for us to know because it's going to be happening in our field regardless. So if we are educated more, our patients can be educated more and they can ultimately make the right decision for themselves.
That sounds sensible.
Thank you. Thank you very much. He'll probably be on time. I spoke with him this morning. He was like, "Do you want me to prepare slides?" I was like, "No, it's really casual."
We don't
Uh,
do slides.
I was like, "If you want." Oh my god, I'm dying. He just entered exactly 2 on the dot. He must have been, like, waiting there. Great, you ready?
Ready.
Alright, let's do it. We gotta get you a ring light too.
Definitely.
Totally.
I need a studio.
Yes,
It
which
does give you good lighting. I have to say, like the whole thing going on there is very good.
So, today we are kicking off a two-part episode with someone I've been really excited to have on. Dr. Layne Martin is a sleep apnea dentist based in Florida, co-inventor of the FDA-approved airVata oral appliance, and someone with one of the more unconventional career stories we've heard on this show. He sold his practice at 43 to go back to an orthodontic residency just to better understand the airway, and now he works as a concierge sleep dentist treating patients with his own oral appliances while also running two startups in the sleep space. Sleep is honestly one of the most talked about yet least understood corners of dentistry. It's a space a lot of clinicians find intimidating, and most patients don't even know their dentist could be a part of this conversation. So that is exactly why we wanted to have a Dr. Martin on, to pull back the curtain a little and make this more accessible for everyone. That one went a little longer than planned, but I just like had so many things I wanted to make sure we covered, and I feel like we actually got everything.
Wow.
Everything.
So really interesting. I was more interested in the patient side of it. You and he were kind of, going back and forth on the provider side. But does he think everybody should be sleep tested? A
I was gonna say, so yeah, we did get very heavy into the
lot of
science
mandible.
and a lot of mandible. Lots of
A lot
mandible
of,
talk. I
yeah.
know. So we should tell everyone as we start, your mandible is your lower jaw. You have your upper jaw where your upper teeth lie, then your lower jaw can move all around like this, and that's your mandible bone. So we talk about that, and you were a little confused, understandably. I do think he thinks everyone should get a sleep test, like just so you know your baseline. Because if you're sleeping great, great. There's no harm in gathering more data, and a lot more people have apnea or hypopnea than they know themselves. And it does even if you're not like suffering in the middle of the night, you're not clenching these like extreme symptoms. It's like if I'm sleeping, I want it to be I'm unconscious. I'm literally not doing anything for 10 hours or whatever. I sleep a lot. But so I want
Wow.
it to be I want it to be like its optimum time, right? Like otherwise, why am I sleeping that long and wasting my day? So I personally want to like gather more data and see like if I'm not. So I think you and I should get sleep tested and mom and Ryan.
I also think that what he was talking about in terms of for adults recovery, and what he means is the cell is kind of resetting and eliminating toxins and wastes that are in the cell and kind of getting refreshed for the next day. That's something that I think is more and more people are going to find that that is an important thing to monitor and associated with, inflammation in the body and,
100%.
all sorts of these collateral problems that if you're not, cells aren't operating optimally, it leads to some problems potentially.
Totally.
Yeah.
Totally. I'm really excited for it. I think that, yeah, I also love how accessible he is. Like, if anyone is interested, even in the slightest, and even if it sounds like he's open to being, he welcomes criticism or people's thoughts. So if people want to pepper him with questions, like, I think his attitude is bring it. Like, I'll show you otherwise. So really cool
Uh-huh.
episode. All right, let's welcome Dr. Layne Martin to Medical Morons.
So I received a scholarship from the Navy for dental school, had a great career in the Navy, got out of the Navy. I moved to Manhattan with $2,020 in my bank account. And when I say that, it sounds crazy because I feel like if I knew then what I know now, I don't think I would have done it. I just didn't know better. Started a practice from scratch, had the opportunity to work with some great dentists. And Larry Rosenthal was probably one of my first mentors who really taught me a lot about cosmetic dentistry. I started veneering everyone that walked through the door. And at that point, I met a mentor of mine, Jim Jacobs, who's a pretty famous periodontist. And I started doing a ton of work with Jim. And then Jim said something interesting to me. And I've said this before when I lecture. He's like, I want you to take your skills to the next level. And I think at the time I was like 33 and I'm like, wait, I'm not at the next level. And he's like, you're not even close to the next level. So I went out to Kois in Seattle, which is a continuum for dentists. There's Kois, there's Pankey, there's Spear. And I sat there the first day and I realized I don't know anything about dentistry. It was the most humbling experience I had because I was like, wait, I don't know about occlusion. I don't know about opening up vertical dimension. And I ended up finishing the continuum in about 9 months. And I was having a hard time even implementing it, doing it that fast. I was learning so much. And then I was in a study club in New York City with a bunch of people that taught out at Kois. And one of the guys in the group is a dentist in Staten Island named Victor Avis. And Victor, every time we would discuss these like full arch cases, he'd be like, the person has an airway problem. And I'm like, dude, what do I care about an airway problem? Like I'm doing veneers and crowns. That's all I care about. And after about the 50th time, I'm like, all right, explain to me this stupid airway thing. And then I was like, oh my God, everything that we potentially see in a dental office, worn down teeth, abfractions, high vaulted palate, they're all compensations and they potentially could be an airway problem. And, I missed it for 15 years. So like I'm on a podcast, I'm talking to people like yourself. Like I can't beat up a dentist because I was that dentist. And you don't know what you don't know. And I did something pretty drastic because I was researching, like, how do I fix an airway problem? And the more research I did, I realized that orthodontics was a really great way to mitigate a lot of those symptoms. And I ended up selling my dental practice to go back to do an orthodontic residency at the age of 43, I think I was. Like I went to see
Wow.
Torrin Vulcan, Manny Alicante, the most brilliant orthodontist I've ever met. The guy is orthodontist, molecular biologist, physicist, and biomechanical engineer, which I became all of those things, I guess, at the age of 43. And then I was there and, I trained also Barry Rayfield is an amazing orthodontist that talks a lot about airway. And I realized that it's not necessarily to cure a problem. I think you can cure a kid. Snoring and sleep apnea is like diabetes. What do you do with diabetes? Can't necessarily cure it. You can mitigate symptoms, GLPs, insulin, diet. But the other thing that happened while I was a resident was that a patient of mine died of sleep apnea and he was 40 years old and he had all the signs and symptoms of someone with an airway issue. He snored, high blood pressure, acid reflux, but he had worn down teeth. His vertical collapsed and I made him a night guard. So what do we do in medicine and dentistry? We fix symptoms. So I missed this guy's problem. And I realized if it happened in my office, this is happening in every dental office in the country. And it's basically a better night guard. And, I didn't mean to go off on a tangent, but my story, everyone's always like, oh, give me a bio when you're lecturing. And I'm like, no, my bio is my story of how I failed in every aspect of dentistry. And my favorite slide in every PowerPoint is the Eleanor Roosevelt slide. Learn from the mistakes of others. You can't live long enough to make them all yourself. And I've made every mistake you can make as a dentist. And I think it's helpful to dentists to hear that because, especially through the AADSM, which is what I'm boarded in, I'm a diplomat. I feel like a lot of dentists are intimidated to treat sleep, and sleep's like the hottest topic in dentistry. And I'm telling dentists it's a better night guard. Now, I've taken some slack over that from people that are part of the AADSM. But if you think about it, there's 90 million Americans that are undiagnosed with sleep apnea. There's 3,000 dentists that are boarded in sleep. There's 200,000 dentists. This has got to be more than just those 3,000 people.
100%. No, it's a really interesting story and makes me so once you finished, I guess, residency, what was your career pivot from?
So I wanted nothing to do with even treating patients anymore. I really was doing it for the credibility of building products. So right now I have two startups. I have a oral appliance company that I started, and then I have a pillow company. And it was really more of creating access to care. I'm faculty in my ortho program, and I have to tell you, like when I sit with the residents, I literally say to them, you guys are the most important people to treat a medical problem. Because if you think about medicine, what does medicine have to treat snoring and sleep apnea? They have CPAP, which is awesome if someone could wear it, and they have hypoglossal nerve stimulation, what's called Inspire. But the beauty of dentistry, we have orthodontics, we have better restorative dentistry, we have oral appliance therapy. There's so many adjuncts that this is really the collaboration between medicine and dentistry. There's always been a disconnect. This is the piece that has to fit together.
So when you started to be like, I want to make my own product, because you could have just started using these other devices that are already out there. What was that shift where you were like, I'm going to do it myself?
Great question. So Michael Gelb, who's one of my business partners, when I was an ortho resident, I noticed that a lot of my adult ortho patients had jaw pain. They were skeletal class 2 and their mandible was trapped back. So when I got to Michael's office, I realized his lower repositioner, him and his dad really pioneered this kind of sleep and airway thing because they brought someone's mandible forward. Michael and I launched this program to teach dentists. We were just going to teach it. But what happened was I was doing a lot of these oral appliances. One, they were way too rigid. Two, tons of bite changes. And I looked at Gelb and I said, all right, what could I do in every person that walks through the door? Clear aligners. It doesn't matter what their teeth looks like, morphology, undercuts. So we developed a device ourselves. And I got us FDA cleared. I did most of the R&D with Michael. And that was kind of the premise behind it. I realized that compliance wasn't great, even on the devices, because, and even some of the devices I've done, they were rigid enough and they had like enough embrasures or interproximal. They were popping contacts open. People were getting posterior open bite. And that was kind of the birth of our first device. Our new one now is even different.
What is a mandible?
A
Such
lower
a good
jaw.
question.
That's right. You know what? I forgot we were talking I thought we were talking
You forgot you were talking to a moron, right?
basically, if anyone's ever taken CPR and you've taken a CPR course, when you have a trauma patient on the ground, then you can't tilt their head up, you jaw thrust them. So basically, our device is a way to just jaw thrust themselves. It brings their tongue out of the back of their throat. So snoring is not only an airway issue, it's a soft tissue problem of having your tongue too far back. And then the tongue tie thing is the little thing under your tongue if you can't kind of suction your tongue to the roof of your mouth. So it's people like that. If you make a
It's
clucking
too tight.
sound, yeah, and it could kind of pull your jaw back.
And just in more like general terms for because I'm thinking of one of my friends who is I don't know if she wants me to tell people that she's struggling with sleep apnea.
It's all right. Have her call me.
Okay, I will. I will. I think she'll appreciate the shout out. But people want to have an idea of what's going on with their bodies these days. So, in a more simple term, Dad. So, first of all, mandible is the lower jaw. So, we have an upper jaw and the lower jaw. And the lower jaw is kind of a free, it can move around, right? You can't move your upper face around, only your lower jaw. So, and Layne, correct me if I'm saying anything wrong with what you're trying to say, but ideally, when we're sleeping, your tongue is suctioned to the roof of your mouth, and there's a airway is patent. It's open, and so you can breathe normally. If we're like leaning back like this, just with gravity, our tongue is going to start falling backwards in towards our airway and closing that space, making it harder to breathe when you sleep. And so, what a lot of these devices do is they help bring your lower jaw forward, and that therefore gives more room for the tongue to become forward and keep the airway patent, even if gravity or whatever is happening could want to force it in the opposite direction. Does that make sense for everyone?
That was great.
Okay.
I
Feel like I need to bring that to my lecture.
You're
that
not
was
you don't have morons as your lecture.
so another moron question just
Yeah.
for some context. I mean, how do you know if you have sleep apnea? Why is it a problem? You know, again, if you don't mind taking 2 minutes and just dumbing it down for
Yeah.
me, because I don't know anything about it.
So there's tons of comorbidities around having an airway issue, whether it's high blood pressure, diabetes, acid reflux. But some of the bigger things are kids with ADD, ADHD. I would even take a guess at some kids on the spectrum. They're not getting oxygen to their brain. So what Kylie said was when you sleep on your back and your tongue falls back, it obstructs your airway. Your oxygen level goes down. So in the kids, the ADD, autism, in adults, it's brain fog and it's dementia. So everyone is always talking about longevity now and living longer, but it's not just living longer, it's living better and it's being healthy. So I would argue if you're snoring, there's no such thing as benign snoring. If you're snoring, you have an airway issue. If you're clenching and grinding your teeth, which is what I mistreated for 15 years, right? If Michael, if I asked you why someone grinds their teeth, what do most people tell me?
I assume like stress or something like that.
Yeah, but it's stress from suffocating. Your daughter sees 3 and 4-year-olds that grind their teeth. Did the 3-year-old have a tough day at the office?
Okay, fair.
But the other issue is this, that the best analogy I can give you, not that you guys would speed, but if you were ever speeding in your car and you went past the cop and you look in your rearview mirror and you see the lights on, what happens to your body? Your heart rate goes up, your blood pressure goes up, and you clench down. You go into fight or flight. Someone with sleep apnea, that's happening 200 times a night. So any patient I see on multiple meds for blood pressure, I know they have sleep apnea, or I think it, or the clenching, grinding, the not getting oxygen, the having to get up and pee in the middle of the night. So that's why so many people have like the high blood pressure. I would even argue acid reflux. First of all, if you sleep on your back, your tongue falls back. But when your body's in fight or flight with the cop analogy, what happens? It depletes blood flow from your extremities and it goes to your heart and your brain. And it goes away from non vital organ systems. So normally at night you digest food in this direction, but now if you deplete blood flow and oxygen, it's going to come back up. Or the same thing for reproductive system. People have to get up and pee a lot. Kylie probably sees kids that are bedwetting. That's a huge issue. So I hope I explained that okay.
So clinically, how do you define sleep apnea? Is it somebody who during sleep is only getting, less than 90% oxygen to their brain? Is that the clinical
It, it's it's
definition? Or
it's one of the parameters. So I always give the analogy like I have a hose, and my hose is like an airway, and the same thing with water running through it. Well, if I kink the hose, the air is not going to go through the same way. That's what's called the hypopnea. An apnea is that the hose is closed. That's kind of the tongue falling back or other things obstructing your airway. Any patient that has any of those comorbidities, the high blood pressure, the snoring, the clenching, grinding, the severe wear, I sleep test them. So it's like an aura ring on steroids. And what you do is you sleep with it. You can either, after COVID, a lot of people don't go and sleep in a sleep lab. Now we're doing home sleep testing, which is great. The metrics are great. And we just look at the data. And you can see to your point, like, is someone's oxygen levels going down? So when I see oxygen levels, in the 80s, that really concerns me. That's the kind of the Alzheimer's dementia part.
and how do you test? What's the device? Is it like an EKG that somebody's strapped to? Like when you do a sleep test,
There's
what's the
multiple. There's So I was using something called the watch pat, which was a watch and a finger probe and a respiratory effort belt. Right now, I'm using something that goes on your finger. One of the pulmonologists I work with, we're using something called Prana Q. Super comfortable. You sleep with it. It gives us that AHI number. It gives us oxygen. It also gives me an autonomic nervous system report, so I could see how often someone's body's in fight or flight. That was kind of the police analogy. So yeah, it's incredible data. I'm like a data freak. I'm like, all right, I want to look like I make statements like if you're doing a night guard for a patient, you should sleep test the patient. So any patient or anyone that's kind of watching this or listening, if you're clenching and grinding your teeth and you don't have a neurologic problem or you're not taking an SSRI, you got to have your dentist kind of examine you or ask your physician to kind of sleep test you.
So interesting. So, okay, before we head into like the fully kind of like clinical sleep apnea questions, because we're heading that way anyways, I can you just give a little bit about what's the name of your practice? What do you do on a day-to-day basis? airVata, your pillow, just like a little bit of your business ventures, and then we're gonna get into all the geeking out.
Yeah, so our mouthpiece company is called airVata. It looks literally like we have a night guard. That's our night guard, and then that's our sleep appliance. And the sleep appliance is almost like a what we in ortho call like a class two elastic. And I have the mouthpiece company, and we were doing great. And I was testing people, and what was happening was people that I was testing, I was looking at the data, and I saw that some of the people were still having events when they were on their back. So a friend of mine is an ear, nose, and throat doctor. He told them the patients to put a tennis ball in their t-shirt. The problem is if you roll on a tennis ball, it could subconsciously or consciously wake you up and break your sleep cycle. So then he's like, well, what would you do? And I'm like, I don't know, a pillow. And I was like, how could I create a pillow where the head part goes down and the back part pops up? And I made our first pillow, and I knew how to sew from suturing in someone's mouth and face. And so yeah, now we have a pillow company. And I test
Amazing.
pillow. Here's our pillow.
I was gonna say, I saw the pillow. It looks very comfortable. It's kind of like, it's like a pregnancy pillow, but like more
Exactly.
targeted. Super cool. And you mentioned
And
earlier that your device, you wanted to make your own device because you saw problems with the other ones. Can you talk about what those problems were and how your device is different, like how you address those problems?
so the first issue was comfort because I think that there was an issue with compliance because people are not compliant wearing a CPAP machine where they're going to be more compliant wearing a mouthpiece. But sometimes, like anything, if you get into bed, you have to be comfortable. So the mouthpiece has to be really comfortable, like what you do for patients, clear aligners, super comfortable. So that was the first issue. The second issue was major bite changes. When you put someone edge to edge, they're going to end up their back teeth might not touch. So that was another issue. I would argue that I'm more concerned with someone's airway because, your teeth should only touch 15 minutes a day when you swallow food. You have to breathe for 1,440 minutes a day. It's a little bit more important. But at the end of the day, you need stable occlusion. You need your back teeth to touch. That was the second thing. And then also, because the material was rigid, people were starting to get spaces between teeth. So we kind of combated all of those things where we made an appliance where the person can get into their normal bite. The material is beyond flexible. I mean, I could bend the thing in half. We're going to be printing at a millimeter. So right now, Invisalign is 0.75 millimeters. Essex retainers, which are the retainers after Invisalign, are a millimeter. We're going to be the same thickness. But the nice thing about this material is I could run it over with my car and it won't break. It's amazing.
That is awesome.
And it's easy. There's no adjustments.
Just a little bit on the logistics, like, you don't have a background in engineering or product design. How did you even know what to do to like, if I saw something rigid, I'd just be like, "This doesn't work, it's rigid." Like, it's like, how did
But
you figure it
it
out?
here's the thing. It was done way before me. It was clear aligners, right? And I always say, like, if I'm the
So you
smartest
kinda
person,
combined a couple different things
totally.
into one.
Yeah, I combined a couple of different things. I took the background in ortho to look at, durometers of elastics. And I was trying to figure out, like, all right, how do I create something that's strong enough, that's not going to break, but that could keep their mandible, their lower jaw from falling back? And we tested all these different things. First, we were using silicone. I was using orthoelastics. I was using powered, like you name it, I tried it. And I failed at a lot of it. I think that, people are like, you're an entrepreneur and this. And I'm like, oh my God, being an entrepreneur is not for the faint of heart. It is, yeah,
A
it is
humbling
not.
experience.
And then the pillow was just I went to a fabric store on Long Island. I had a friend print out our pillow from a CAD design, and I sat at the fabric store and I used scissors. I cut it. I had some thread, and I sewed the pillow literally on the floor of that store.
That's amazing.
So that was part one of our two-parter interview with Dr. Layne Martin. In the next episode, Dr. Layne even lets me give him some pushback and ask some questions related to the more controversial topic of sleep medicine. So you'll have to check it out in our next episode. Tune in. Thanks for listening to Medical Morons. Don't forget to subscribe, rate, and review.